And joining us now, CBS News medical correspondent Dr. Jennifer Ashton. And I should add in the beginning, unlike some doctors on TV, nothing against them, Dr. Ashton still sees patients every day. She is an OB/GYN. Doctor, I want to talk to you about this ruling that shocked a lot of people this week, including me, on mammograms, and where you have a government advisory committee saying that women under 40 should no longer get regular mammograms, that women 50 to 70 should get them just every other year. And to me, the most shocking part of it all, telling younger women they should no longer do breast exams themselves, which, you know, I'm not objective about this. I am a cancer survivor. But I want to ask you, as a doctor, what are you telling your patients about this?
Well, Bob, first and foremost, as I had been telling them all along, be your own healthcare advocate. Be informed, be educated, ask your doctor questions, and always ask what the risks versus the benefits versus the options of any test or any treatment are. When you talk specifically about breast cancer screening, I'm telling them to continue being familiar with their own body, to continue checking their breasts if that's what they had done in the past, and to continue along the screening that they had been doing, which, if they're 40 or over, included a yearly mammogram.
Well, what about this idea of telling young women not to conduct self-examinations?
Well, again, you know, that is not really new. In the medical field, we've known that self-breast exams or even doctor breast exams are not that accurate, and they can generate a lot of false positives, things that may feel like cancer but turn out not to be, and that then in turn generates a lot of biopsies for the patient. I think that many women, in fact about 70% of breast cancers, are initially detected by palpation after either the doctor or the patient feels it themselves. And I think, again, risk versus benefit analysis on that level, when you're talking about someone with cancer, the benefits outweigh the risks.
So you're saying continue the examination and then go talk to your doctor.
Absolutely. And I think to disempower a woman about her own body, I think, again, really potentially stacks the deck against her when you're talking about things like her health and things like cancer. What
is your biggest concern about this?
Well, I think after the week we had, Bob, with not just the breast cancer screening, but then the cervical cancer screening guidelines, giving women, as well as their doctors, really a 1-2 punch, so to speak, I think the risk is that if women get the message that they don't need a pap smear every year and they don't need to get a prescription for a mammogram every year, that then they will say, well, then why should I go to my gynecologist? And I think that that would be a very unfortunate consequence of this week. The fact of the matter is that gynecologists, women's health specialists like myself, are the primary care physician for women in this country.
Let me tell you what Bernadine Healy, who used to be the former director of the National Institute of Health, she said that if the new guidelines are followed, more women will die of breast cancer. Do you believe that? Do you agree with that?
I do, Bob. And, you know, let's look at what the science said about the mammography debate, because I think that it was oversimplified to some degree this week. I think that you had people coming down on the side of the cold facts, hard science, and then you had those talking about the raw emotion. And in reality, it's really somewhere in the middle. The fact is that the mammography debate, in terms of its accuracy or lack thereof, especially in younger women, started in the 70s, but it's really the best we have. And I think that because a certain percentage of breast cancer is diagnosed in women in their 40s, to completely send the message that it really is not having any positive value is wrong. And in fact, the task force has acknowledged that good scientific data has demonstrated the benefits of mammography in younger women, but what they found, Bob, is that the risks or the harms in that age group outweighed them. I think when you're looking face to face at a patient, as I do, and I look them in the eye and have to hold their hand and tell them they have cancer, the patient and her doctor can decide whether those risks or those harms are too great.
All right, doctor, thank you so much for being
Bob.
with us this morning.